So I'm going to talk today about promoting healthy weights at community and policy levels. As the other speakers talked about, it's one thing to look at what's happening at an individual level, but we've moved away from just thinking about what has to happen with individuals and how do we actually create healthy communities and how do we create policies that can help make the healthy choice the easy choice for people to promote their healthy weights. So I just have a few quotes here from some obesity researchers that really make the point clear that contemporary obesity is actually a natural and appropriate response to the environment in which we live. That obesity hasn't happened in a vacuum. Our environment has changed, and the way that our environment has changed is it's encouraged us to eat more and to be less active. And so our obesity is actually an appropriate response to that environment. So if that's the case, we need to change that environment. And Dr. Kelly Brownell actually would call this environment that we're living in a toxic environment. Well, it's one thing to say that the environment is our context for behavior, but it can be very almost disempowering when you think about it in just a general way because of the fact that, you know, the environment is big and it's out there and we may not feel like we have any control over it. But Boyd Swinburne and his colleagues in Australia have developed something called the ANGELO framework. And ANGELO stands for an analysis grid for environments linked to obesity. And the idea behind the ANGELO framework is to actually give some concrete ideas around what is it in our environment that is structuring our behavior. And it enables us to think about ways in which we might want to change those environmental contexts. So the environment, according to the ANGELO framework, can be broken down into 4 key components, and that's the physical, the economic, the sociocultural, and the political environments. And I'm going to go through each of those in order. The physical environment is basically asking the question, what is available? Do we have access to fresh fruits and vegetables in the stores that we are able to go to, that are close to us in our neighborhoods? Do we have safe places to walk and be physically active? You'll see here in this slide sort of a typical suburban street with the emphasis on the 2-car garage, but yet no sidewalk. So, you know, our environment certainly is more structured around cars than it is around active transportation. And then from a perspective on the eating side of things, there's a lot of neighborhoods where you might not see such a prominent display of things like fruits and vegetables as we see in this picture. The economic environment is basically asking the question, what are the financial factors? And so the way that our environment is structured may actually there may be some economic rationale for that. So, for example, marketing of things like soft drinks or fast foods makes a lot of money for big companies, and those companies place a lot of investment into marketing products that aren't necessarily good for us. And certainly the budgets for marketing are probably 100 times that of the budgets we have for nutrition education. So when you see organizations like the Food and Agriculture Organization and the World Health Organization making statements such as heavy marketing of energy-dense foods and fast food outlets are probable causes of obesity, it recognizes that, you know, that environment, that economic environment that we are living in is certainly helping to structure our choices. This is a Canadian example. This is using Stats Canada data on the cost of food. And just the cost of milk is shown here in the blue line, and it has gone up over from 1995 up to 2009. It's gone from about to $1.40 for 1 liter up to about $2.40 for a liter. Whereas for soft drinks, like a cola drink, was about the same cost as milk way back in 1995, but its cost has not increased much at all over the last 15 years or so. So when you think about that, it's really somewhat strange that our food system is structured in a way so that foods that are better for us are actually costing more than foods that we should encourage people to consume less of. Now, the sociocultural environment is really asking the question, what are the beliefs and values? And we think about culture in terms of ethnicity, but we can think about it even more broadly. In our culture, the idea of sedentary living and overconsumption have become very normalized. And we can think about tobacco and the tobacco reduction movement over the last 20 or 30 years. What has been successful in tobacco reduction is denormalizing smoking. So 30 years ago, everyone, the majority of the population were smokers, and it was acceptable to smoke wherever you were. Now, what's become normal in Canada is not smoking, and it is unacceptable to smoke in public places. Well, what we can think about in terms of food and physical activity, it used to be very normal to actively commute, to walk to school, to walk to work. Now our environment is more structured around vehicles, and which makes it a much more sedentary lifestyle. And the same thing around food, the normalization of fast food outlets and soda machines and pop machines and that kind of thing. They're everywhere, which was not the case. So we've really normalized that sedentary living and overconsumption. And if we want to address obesity, we're going to have to work on making that less normal and making the opposite more normal. And then the final environment is called the political environment, and that's basically what are the rules. And this is just a pictorial example of transportation policies. Now, one of these is in North America. You can probably guess which one, and the other one is in Europe. And the idea of what our transportation policies in North America really do foster is more of a vehicular transportation and much less active transportation. So, those are illustrations of the different aspects of the environment. So how do you actually go ahead and change that environment? So what I would like to give you a few examples of are some community-based and policy-level interventions. And I'm going to start with the more local community-based interventions, and I'm going to use a case study of a project that I've been involved with for about the last 5 years. And it's called the Healthy Alberta Communities Project. Now, this is a community-driven health promotion project, really has grown out of the types of ideas that started in the 80s in the Canadian Heart Health Initiative, but has developed over time and has become a little bit more sophisticated. But what we see is a community as an entry point to broader structural change. It's an opportunity for us to address those environments. And if you are interested, there is a recent article that's just been published on the Healthy Alberta Communities Project in the International Journal of Public Health in 2010. So, the Healthy Alberta Communities, our acronym for that is PHAC, not the best acronym, but it is. How do we work? Well, basically, we work with the communities to target the determinants of health. So we actually go into the communities and we use that Angelo framework with the 4 different environments, and we ask people to think about what's functioning in their communities to promote sedentary living and overconsumption of food. So we target the determinants of health in the community, and then we leverage resources and rely on the work of individuals, group, and organizations already in the community. So we're not sort of helicoptering in expertise. We're trying to work with those people who are already well familiar with the community, that know the resources, know what's available in their community. In a lot of cases, however, communities have a lot of really good stuff going on, but it's not necessarily well coordinated. So what we did with the Healthy Alberta Communities Project is we hired community coordinators to help define where those opportunities for action were and to coordinate people working together. Then we also had a little bit of seed money, so we could invest some of that seed money to help kickstart some activities and to maintain some momentum.